Well, good afternoon and welcome to today's webinar briefing on the independent budget, Veterans Agenda for the 117th Congress, and our budget recommendations for the Department of Veterans Affairs for fiscal years 2022 and 2023. My name is Heather Ansley, and I am the Associate Executive Director of Government Relations with Paralyzed Veterans of America. I will be serving as the moderator for this afternoon's webinar. Today's event is hosted by the Independent Budget Veteran Service Organizations, or IBVSOs, DAV, Disabled American Veterans, Paralyzed Veterans of America, and the Veterans of Foreign Wars of the United States, VFW. The purpose of this webinar is to provide you with a short overview of the IB's critical issues for this Congress and also recommendations for VA's budget that we released on February 1st. The full reports are now available on independentbudget.org. DAV, PVA, and the VFW have been working together for over 3 decades to produce comprehensive budget and policy recommendations on issues impacting veterans through the construct of the independent budget. This year's budget and policy recommendations were made as VA and the world are responding to a pandemic that has impacted VA's operations and veterans' access to healthcare, benefits, and other transition services. Historically, the IBVSO's Veterans Agenda has enumerated a list of critical issues for Congress to address, as well as a lengthy list of policy recommendations. In preparing our agenda for the 117th Congress, we made the decision to break with our past practice and address only critical issues this year. The Veterans Agenda lays out 11 critical issues that are focused on healthcare, benefits, and education and employment. Each organization played a role in authoring and collaborating on the development of these critical issues that you're going to hear more about shortly. We also continue to support the policy recommendations we put forth in our previous agenda. In addition, each IBVSO has a robust policy agenda that covers a wide range of issues, and we invite you to consult our respective agendas for further information. Another important item for discussion today will be our budget recommendations for VA for FY 2022 and 23, advanced appropriations. The IBVSO's budget recommendations reflect our best estimate of the funding that VA will need to address veterans' demands for services from the Department of Veterans Affairs. I'd now like to introduce the panelists for today's event. First, Shane Lehrman is the Deputy National Legislative Director for DAV, and he will present an overview of the benefits critical issues addressed in the Veterans Agenda. Second, Roscoe Butler, Associate Legislative Director for PVA, and Joy Elam, the National Legislative Director for DAV, will provide an overview of critical issues discussed in the healthcare section. Third, Patrick Murray, Director of VFW's National Legislative Service, will discuss our critical issues for education and employment. Finally, Peter Dickinson, Senior Executive Advisor for DAV, will discuss our budget recommendations for VA for FY 2022 and 23. I'd now like to turn it over to Shane, who's going to begin our presentation by talking about the benefits critical issues. Shane?
Hello, everyone. What we're going to be reviewing is the critical policy goals that have been established by the independent budget for the upcoming year, and I'm just going to highlight on a few of those. First, the independent budget has 3 critical issues regarding benefits and claims. The first one is increased transparency and reform for VA claims, which includes reintroducing the pre-decisional review, or the 48-hour VSO review, and to establish claim dates for treatment of presumptive diseases. Today, I will focus on the reintroduction of the 48-hour or the pre-decisional review. For over 7 decades, VA maintained a policy which allowed accredited VSOs a pre-decisional review period of 48 hours for decisions on those veterans and claimants the VSO represented. After reviewing these decisions, VSOs were able to notify VBA of errors before a decision was formally promulgated. The types of errors identified include incorrect dates of grants or effective dates, incorrect evaluations, and incorrect combined evaluations to include incorrect denial of benefits. If VA agreed, it would issue a new decision, and this process benefited many veterans and claimants, and in many instances, avoided the time-consuming and often costly appeals process. In April, VA officially eliminated the pre-decisional review period. Two recent reports from the Office of the Inspector General confirm the need for the pre-decisional review, which provides representatives the ability to work with VA to identify and correct these errors in VA decisions before any final promulgation, acting as another layer of quality review. Next slide. Therefore, we recommend Congress to enact legislation to permit service officers to review VA disability benefits ratings 48 hours prior to their final promulgation. The next critical issue is veterans exposed to toxic exposures. When service members are subjected to toxins and environmental hazards, our sense of duty to them must be heightened. Many of the illnesses and diseases due to these toxic exposures may not be identified for years, even decades, after completing their service. We have several recommendations, including Agent Orange presumptives, K2 exposures, and PFAS exposures, but today I will highlight framing the presumptive decision-making process. Due to the many inconsistencies among the presumptive processes and the process to establish presumptive diseases, the IBVSOs recommend Congress include a new framework that includes, next slide, please, improved DoD and VA data collection and record keeping. They need to improve these so we can have something to refer to prove if and when and where veterans were exposed. Next is establish a concession of exposure or recognition of toxic exposures prior to establishing a presumptive as a way to enhance direct service connection for those conditions not yet having a presumptive process. This is very similar to the concept that was introduced in last Congress by Senator Sullivan and Manchin in reference to their Veterans Burn Pit Recognition Exposure Act. Also, require statutorily mandated future studies on known exposures, provide a time requirement for action by the VA secretary so we're not waiting 4 years for additional diseases to be added, just like recently what happened with Agent Orange presumptive diseases, and it took Congress to get those 3 additional diseases added. Maintain the standard of positive association versus causation and update the classifications of scientific association. Our third critical issue for benefits is to improve benefits for survivors and their families. We're going to focus on 2 of the many recommendations we have. Since Dependency and Indemnity Compensation, or DIC, was created in 1993, major improvements have been legislated only once, and that was in 2003. While minor enhancements have been implemented, there is still much that can be done to improve benefits for the survivors of America's veterans. DIC rates have failed to keep up with the cost of living and fall short of what federal employee survivors receive. Next slide. Therefore, we recommend Congress index the rate of compensation for DIC to 55% of a 100% disabled veterans compensation to provide parity with what federal survivors receive. If a veteran is 100% disabled, to include individual unemployability for 10 consecutive years prior to the veteran's death, and the death is not service-connected, Surviving spouses of minor children are eligible for DIC benefits. However, if a veteran dies due to a non-service connected condition before they reach that 10 consecutive years of being totally disabled, their dependents are not eligible to receive the DIC benefit. Therefore, we recommend Congress replace the current 10-year period for eligibility for DIC with a graduated scale that begins at 5 years and reaches full entitlement at 10. I want to thank you for your attention today, and I would like to turn it over to our next presenter, Roscoe Butler with Paralyzed Veterans of America.
Thank you, Shane. So I'm going to be discussing 3 critical issues during this presentation. The first critical issue deals with ensure veterans access to long-term care and supportive services. As you see, there's a number of recommendations: support for aging veterans, additional models of institutional care, support for aging veterans and veterans with significant disabilities, oversight of geriatrics and extended care, expansion of the caregivers program, and cost of medical foster homes. Next slide. So, as you know, VA operates a number of long-term care facilities through 131 community living centers. They provide grants and per diem support to 157 state veterans homes and provide per diem supports to veterans in hundreds of community nursing home facilities around the country. We're calling on our Congress, IG, GAO to conduct rigorous oversight on VA long-term care and geriatric extended care services to ensure they meet the needs of our nation veterans. We want Congress to direct VA to establish standards for and implementation of a facility-wide standardization tool for assessing the non-institutional program needs of veterans. We also call on VA to enter into contracts and agreements for the placement and payment of medical foster homes for veterans unable to safely live independently. This will require Congress to grant VA the legislative authority, because as it stands currently, VA cannot pay for medical foster home care. Therefore, veterans have to pay for that care out of their pockets. And no veteran should be required to pay for care that is quasi-coordinated by the VA. And lastly, we want VA to begin phase 2 of the caregivers program expansion on or before October 1 of 2021. As you recall, the phase 1 was implemented October of 2020. VA was over a year behind in implementing it, and therefore they stuck with the congressional language to implement phase 2 2 years after phase 1 was implemented, without taking into account that they were over a year behind schedule. So we're calling on Congress to require VA to advance the schedule for phase 2 and implement it on or before October 1, 2021. Next slide. The next critical issue is improve VA scheduling system, supply chain, and fourth mission. We're calling on VA to implement their scheduling system in advance of implementation of their electronic health record. We feel that it's important that the scheduling system be implemented across the VA spectrum timely, and that all veterans will have the ability to schedule their own appointments, and VA have the access with a new scheduling system and replacing the antiquated, outdated scheduling system that will help to improve excessive wait times. We also call on VA to move forward with accepting DoD's supply chain and replacing their VA supply chain with DoD's supply chain and management system. VA supply chain is currently outdated and needs to be replaced. Therefore, they've looked at the DoD system, they've developed a plan, and so we want Congress to ensure that the plan is implemented accordingly and that VA is on target with implementation of both the VA scheduling system and their supply chain. Next slide. So just an overview of what we just talked about, the staffing model and the supply chain. So we're going to go to the next slide. The last critical issue is ensure sufficient VA healthcare staffing. One of the major issues VA is challenged with is their ability to hire staff and bring them on board in a timely manner. And so there are 4 points to this critical issue. An improved staffing model, workforce salary, VA oversight and accountability, and effective succession planning. Next slide. To ensure that VA's staffing is implemented appropriately, we call on VA's effort to provide additional pay, compensation, and retention incentives to make VA services more competitive with the private sector. One of the big challenges is that we know that across the VA system, VA cannot match what VA providers, clinicians, nurses, technicians can make out in the private sector. But we're calling on Congress to ensure that VA has the resources and tools to address pay parity so that they can be as competitive as the private sector is in recruiting people. Next, we want to require VA to design an effective succession planning to ensure adequate VA staffing is available in future years to meet veterans' healthcare needs. As we look across all of the federal government and the baby boomers are beginning to retire, it's important that VA has an effective succession plan to address their needs as employees begin to retire from the VA system. Lastly, we want to require VA to develop and implement staffing models that correlate with current needs of veterans. And that's critical and important so that the staffing models that they put in place will ensure that it meets the needs of the number of veterans accessing the system, and they can rapidly hire staffing to meet those needs. So that's the end of the 3 healthcare issues I will be discussing. I'll hand it off to Joy Elam so that she can conclude with the remainder of the healthcare discussion topics.
Thanks, Roscoe. Good afternoon, everyone. I'll be covering 3 additional health-related critical issues. First is rebuilding VA's infrastructure. VA has a vast number of medical facilities and access points of care throughout the country. However, VA's infrastructure is aging, with many of its facilities 50 years or older. There are significant funding needs associated with the upkeep for just basic routine maintenance, modernization, and construction of any new facilities. And the IB has been talking about insufficient funding for these infrastructure needs for years, including a significant backlog of life safety and other infrastructure projects that need to be addressed, and leasing issues that continue to linger without resolve. To address these issues, the VA Mission Act required that VA conduct market assessments, develop community care networks to expand care, and conduct an asset and infrastructure review, or an AIR process. The market assessments and the implementation of the community care networks were delayed due to the pandemic, and there was really little consultation with veteran stakeholders during the process, which was required by law. The IB, next slide, please. The IB recommends including extending the AIR timeline by at least 1 year to assess the impact of the pandemic on healthcare utilization patterns, and to allow for the full completion of community care networks being established. Modification of PAYGO rules to address scoring problems with building leases, hiring appropriate personnel to manage VA construction portfolio, and developing a strategic plan to meet infrastructure needs for veterans' long-term care needs. And finally, 2 specific recommendations for VA: early engagement with local veterans in the AIR process before making key decisions, and ensuring that VA partners with VSOs on an AIR communication strategy, but will be critical for making sure it's a successful process. Mental health and suicide prevention remains a priority issue for the independent budget groups, as it has for Congress, with the passage of 2 major mental health bills being enacted last year. VA provides a significant amount of mental health services to veterans who are at risk, higher risk for mental health challenges, post-deployment mental health issues, and suicide when compared to their civilian peers. And despite the department's focus on providing comprehensive mental health services, and including specialized programs for post-traumatic stress and other issues, including targeted suicide prevention efforts, suicide rates among veterans just haven't budged and have not declined significantly. There's also been a focus on ensuring veterans have timely access to mental health services, with the expansion of access to care in the community through VA's Community Care Network program. So recommendations for this critical issue include requiring VA's community partners to meet the same quality and training standards for mental health care and suicide prevention as VA providers. Ensuring that all emergency room clinicians, both VA and community partners, follow established suicide prevention safety planning protocols, and requiring VA to routinely update clinical practice guidelines for common mental health conditions among veteran population, and improving dissemination of these guidelines and their training protocols. And finally, expanding VA's peer support program for embeds into mental health clinics, and ensuring the diversity of peers to better reflect the local veteran population and demographics. And finally, the next critical issue is refining services for women and minority veterans. VA's patient population is becoming more diverse, including increasing numbers of women veterans, LGBTQ, racial, and ethnic veteran groups. We've noted disparities in access, usage, health outcomes, and patient experience among these minority veteran groups. And some of these veterans report experiencing racial bias, gender preference-based discrimination, and lack of respect when seeking VA care. We also know that some VA facilities have failed to provide a safe, private, and culturally sensitive environment to care for all veteran patients. And stranger harassment has been a documented problem, which resulted in some veterans delaying or foregoing needed health care. Next slide. Recommendations for this critical issue include evaluating existing programs and services to ensure they're clinically appropriate and culturally sensitive for all minority veteran groups, ensuring minority veterans are included in research to evaluate and resolve known disparities, and assessing cultural differences to address identified barriers to care. A good example would be using the Veterans Experience Office to evaluate the overall patient care experience for minority veterans. And finally, increasing staff diversity and peer support specialists that better reflect the veteran populations they serve. So that's it for my part of the presentation. Next up is Pat Murray, from VFW, who will cover employment and education critical issues. Pat, over to you.
Thank you very much, Joy. Thank you all for your attention to these critical issues, and thank you for agreeing to take part in today's webinar. The critical issues that I'm going to discuss are employment and education. The first priority for the independent budget is the unemployment situation veterans are facing due to COVID-19. Veteran unemployment numbers were seeing an all-time low. However, shortly after COVID hit, they were reaching highs that haven't been seen in 10 years. The numbers have subsided a little, but they're still nowhere near pre-COVID-19 limits. The independent budget recognizes this as one of our biggest issues facing employment for veterans in the upcoming year. In order to achieve that, one of the issues that we want Congress to look at is the proper assessment of VR&E staff to ensure the program's success. There were a lot of resources given to the Veteran Readiness Program over the past couple of years, and we want to make sure that those resources are being used adequately and that the changes made are ensuring success. What's working and what isn't, proper oversight needs to be done for this office regularly. Another issue that the independent budget is recognizing as something critical is spousal unemployment and underemployment. Spouses in the military are unemployed around 26%, and a little over half are facing underemployment situations. There are so many talented individuals married to the men and women of our services that are being underutilized. A lot of it is licensing, certification, portability of those certain certifications. These are things that we need to look at in order to address. Finally, in this item we want to bring up for attention is the fourth administration. For years, the independent budget is recommending breaking off the economic opportunity type programs within the Veterans Benefits Administration, VBA, in order to separate them from the Comp and Pen section. Comp and Pen rightfully takes up a large majority of VBA's attention and resources. However, we feel that the benefits such as GI Bill and VR&E and home loan need their own individual respective attention. We think that creating a fourth administration will allow those programs to grow without falling under the umbrella of Comp and Pen. Next slide. The asks and the suggestions the independent budget has for employment and education are to expand existing programs, such as the Vet Tech program. It's such a popular program, it runs out of money every year because veterans are signing up for it left and right. Programs like this need to be expanded upon, and so that veterans can continue to use them to get back to work quickly. Introduce new programs such as the Rapid Retraining Program, which is an employment program for veterans without VR&E or GI Bill eligibility left. It's a short-term employment program that seeks to get veterans back to the workforce as quickly as possible. We'd ask that that Congress enact legislation to make VA revamp VA's auto grant system, which would allow for multiple uses of the auto grant for disabled veterans. Currently, it is a once in a lifetime benefit that, frankly, that's not what veterans need for a variety of different reasons. They need to be able to utilize this to purchase multiple cars in a lifetime, as the rest of Americans do. And then the final ask is that Congress should use its authority to be a convener, to engage in a national dialogue around licensing and credentialing, because there is no one-stop solution. This problem exists due to state, county, municipality, and federal restrictions. There is no easy one-stop federal fix for this problem, but licensing and certifications and the varying portability issues that come with those is something that we think Congress has the unique ability to be the convener and bring stakeholders to the table to discuss ways we can go about fixing this difficult situation. That wraps up my section on education and employment. I'd like to now turn it over to Peter Dickinson from DAV for budget recommendations.
Thanks, Pat. To begin, let me state that the independent budget funding recommendations are just that, an independent estimate of the true level of funding that we believe VA will require to deliver all the veterans' healthcare benefits and transition services veterans have earned and deserve, without taking political considerations into account, which Congress and administration must face. Now, the IB budget model uses the most recent baseline of funding and applies various appropriate inflation indexes to establish a current services budget for FY 2022 and for the medical care accounts that have advanced appropriations for FY 2023. We then project new workload, and we apply a number of other factors and take into account other trends, such as increased utilization of or reliance on VA for medical or other services they provide. And then finally, our budget recommendations include a number of plus-ups to cover the cost of new program initiatives or program expansions, a number of which were mentioned by my colleagues already. Next slide. All of the numbers that I'm about to highlight can be found in our budget recommendations report and are summarized on the main budget table on page 4, the top portion of which I've included on this slide just so you can see what I'm talking about. Now, I'm not going to go through each line item today, but I will highlight some of the most important items in the budget as we go forward. Next slide. The largest line item in VA's budget is no surprise, it's medical care. And of that, medical services is the largest number, which covers all of those medical services that VA directly provides. For FY 2022, the IB is recommending $66.2 billion for medical services. This is almost a 10% increase over this year's appropriation levels. This $6 billion increase accounts for just over half of the IB's total recommended increase for FY 2022. And it's driven by a couple factors. First, many veterans have deferred or delayed non-urgent medical care during the pandemic, which we all hope will be winding down by this fall, certainly by the end of the year. Our estimate is that this will result in larger than usual increases in the utilization of VA healthcare next year. In addition, we believe that, as we have seen in the past, the increased unemployment that the pandemic brought forward is very likely to result in larger than usual enrollment increases and extra reliance on VA healthcare, as many veterans lose employer-based insurance and turn to the VA. Now, to further strengthen access to VA healthcare, the IB does have a number of recommendations. First of which is that the Veterans Health Administration needs to begin a very serious effort to fill the very large number of clinical vacancies that have been there for years. It averaged about 43,000 last year. So we're calling on VA to fill about a quarter of the vacancies for each of the next 4 years. That would be just over 10,000 positions next year. And we estimate it will require about $1.4 billion, which is inside our estimate for medical services. As you heard already, we are calling for VA to complete the expansion phase 2 of the Caregiver Assistance Program. And this will take about an additional $430 million for the FY22 budget. We're also recommending that VA expand long-term care options for veterans, as previously discussed, and particularly home-based care. And so we're looking for about a $335 million plus up above the current services level that's already going to be necessary. And finally, I just want to highlight that we have a number of plus ups and initiatives and ideas on how to improve access to quality care for women and minority veterans, And we've put in about $130 million in our budget recommendations for medical services. Next slide. To ensure that veterans also get timely access to community care and have all their needs met, the IB is recommending $20.7 billion for the medical community care account. That's just over a 7% increase. As with VA provided care, we again anticipate increased utilization of community care due to the deferred care and pent-up demand from the pandemic. We also expect that there'll be a continued growth in the number of veterans utilizing community care options due to the maturation of the new provider networks from TriWest and Optum that were created following the VA Mission Act and which have really started full operations over the past 6 months. Next, we'll talk about VA's world-class medical and prosthetic research programs. We're recommending a 10.7% increase to $900 million. And we would point out there's $10 million earmarked for more research to develop evidence-based effective treatments for women veterans. And now we will jump forward to the next slide and talk about a little bit on the benefit side. So in order to process all the benefit claims and appeals that are continuing to come in, we're asking for some significant increases next year. We're looking at a 12.1% increase for the Veterans Benefit Administration. That's about an increase, as well as a 13.9% increase for the Board of Veterans Appeals. These increases reflect projected workload growth, as well as important increases in staffing to address rising backlogs at each of these. We're looking for 1,000 new FTE at VBA, where there are now more than 500,000 claims pending, many of them due to delays in having disability exams processed during the pandemic. At the board, we're calling for 200 new FTE, where they have a large backlog of appeals hearings, again, somewhat affected by the pandemic, but also due to the changes that came about from the Appeals Modernization Act. Next slide. Critical to the delivery of all of VA's benefits and services is modern IT, and we're recommending almost a 6% increase for VA's IT budget to a total of $5.2 billion. And particularly, we've called for some specific increases to address gaps in IT at certain of the agencies. $175 million for VBA to start addressing a long backlog of IT needs to get their modern processing systems updated. $22 million for the board to take advantage of new artificial intelligence and other workflow processes. And $22 million for VA research and prosthetic programs to help ensure that they're better able to manage and analyze their work. All of these are detailed in the IB budget report. FY 2022 will also be the biggest year yet in the 10-year electronic health record modernization being driven by Cerner. And we believe that's going to require about a 15% increase next year. I would also point out that we are calling for $60 million to accelerate VA's new centralized scheduling system previously discussed. Next slide. And finally, the IB is once again calling on VA, the administration, and Congress to begin providing realistic levels of funding necessary to maintain VA's critical health care infrastructure. Our recommendations for major and minor construction are more than double current year spending. And these come directly from an analysis of VA's strategic capital investment planning process, which looks at the long-term cost to maintain VA's critical infrastructure. And for state veteran home construction grants, we're looking for an increase up to $275 million, which would cover about half of the priority one projects that have been a grant request made and which there's already state matching funding available. Now, details on all these recommendations and many more are available in the IB budget recommendations report. With that, Heather, I'll hand it back to you.
Well, thank you, Peter, and thank you to all of our presenters for your overview today of the information presented in the Independent Budget Veterans Agenda and also the recommendations for VA's budget for fiscal years 22 and 23. We would like to thank you for spending time with us, and know that all of our materials are available on independentbudget.org. You will be able to view both the agenda and the budget recommendations, and also individual PDFs for each of the critical issues is available, again, on independentbudget.org. So thank you again for your time and attention as we talked about these issues that are very important to our nation's veterans. This concludes today's event. Thank you.